Advanced imaging has dramatically shifted in the medical field over the past decade.
We are talking about MRIs, PET scans, and CT scans. Joining us is Hartford healthcare radiologist Dr. Adam Kay, chair of radiology at St. Vincent's Medical Center, with more on how these advancements came about and what patients need to know. Thank you for your time.
Hi.
Absolutely. Nice to be here.
Let's first.
Yeah, so go ahead. Sorry.
No, that's okay. I do want to first talk about the role, medical imaging plays in healthcare today. Why is it so needed?
Yeah, so as modern care gets more and more complex, our oncologists, our cardiologists, our orthopedists, our neurosurgeons, doctors all over the healthcare system, they can only be as good as the data that they have. And what advanced imaging, things like MRI, PET scan, CAT scan allow us to do is see inside the body in new and novel ways that allow us to answer really complex questions for them. And as care gets more and more complex, these sort of quote advanced imaging techniques are becoming more and more commonplace.
And I'm sure this has truly evolved over the years. Can you tell us about some of these advanced imaging technologies that are available right now? There's different kinds, of course.
Sure. Yeah. So PET scanning is what we call another name for it might be molecular imaging, where we use specialized molecules to inject into the body and look into and mimic things that are going on in the body, things like cancer. So for instance, our new PET scanner at the Fairfield Cancer Center has new techniques like we call it PSMA PET CT, a specialized technique that can look at prostate cancer and help the urologists and the oncologists that are treating that do targeted imaging and targeted therapies for those types of cancers. We're doing similar things with new breast cancer molecules that can target certain types of breast cancer and allow the oncologists to better tailor the therapies, the immunotherapies, and the chemotherapies and the radiation therapies that they're giving to better treat patients. Our new MRI scanners like the one we just had installed are able to do things like advanced neuroimaging and looking at brain tumors, looking at patients that have had stroke, and tell us more about what's going on in their brain, so that the neurologists and the neurosurgeons can better treat what's going on in their bodies.
Very interesting. And before we wrap up here, I do have to ask you, with obviously AI really coming into play here in so many different fields, medicine, of course, one of them. What do you think the future is with AI, maybe reading reports? What do you think the future looks like? Is this going to help the field of radiology?
Yeah, absolutely. I mean, it already is. I mean, there are certain types of AI that are helping radiologists and doctors like myself diagnose what's going on in the scan that we're reading. But even more importantly, with regard to what we're talking about with advanced imaging techniques, there's AI that we're already using and employing safely on our scanners that, for instance, allow an MRI scan to be done with better image quality and in a shorter amount of time, so that patients that might be more claustrophobic or not like being in the MRI scanner, which can be a loud and confined space, it allows us to get done with those patients quicker and get more and more patients on those scanners, on and off those scanners quickly, so we can provide even more and better care.
Yes.
Wow, fascinating stuff. Dr. Adam Kay, thanks for joining us today.
Thank you.
Absolutely. Thank you for having me.